So what are these immediate changes? Well, we talked about, and I'm sorry, with time I want to make sure I hit everything and also provide plenty of time for discussion. And as I talk, this is meant to be a discussion. It's not a lecture. We're not charging tuition here. So I want it to be a conversation.
Aren't you doing a test? Are we having a test?
No, there's no testing. This is a conversation, not a lecture. Actually, Rick, for you, I've got a test for you.
Okay.
But please feel free to speak up, raise questions as we go along. So we've got, the other important thing is pre-existing conditions. Pre-existing conditions, a lot of people would not be able to obtain coverage if they had a condition. Insurers are not going to say, oh, well, you have cancer and you were a student, you had cancer, and now you have to buy insurance. Well, based upon your health history, you've got this condition, we're not going to cover you. Or if we're going to provide some coverage, it's going to be minimal coverage, and it's going to exclude whatever you had before. Well, those who unfortunately had to go through cancer, especially those who were able to achieve and overcome and deal with it and beat the cancer, even though there are risks going forward, if they lead healthy lifestyles, and if they've overcome this, shouldn't they have the opportunity to have some type of coverage? Many times the answer is no, they weren't receiving coverage, and so one of the immediate changes was children are covered. It doesn't matter regarding your pre-existing condition. Lifetime limits have been eliminated, and now dependent coverage must be extended to children under the age of 26. If you have a married child, it would extend to that child, but not the daughter or son-in-law, and not to grandchildren. But yes, that continuation could continue, even if they're employed, and could opt for insurance with an employer. In a couple of years, each of us will be required to obtain our own insurance. And this is what's called the individual insurance requirement or the mandate. This is the provision of the law that was actually held by a court in Virginia as unconstitutional, saying that the federal government cannot require the individual to buy their own health insurance. We will see where that goes. It will definitely make its way up to the United States Supreme Court. It's going to take time to get there. We'll see what happens. But for at least right now, everyone should plan on obtaining insurance that provides minimum essential coverage. If you choose not to do that, you will be subject to a penalty that's determined based on your income level. What is minimum essential coverage? If you are covered under a government-sponsored program, you're great. You're done. If your employer provides the care, you're covered. Grandfathered plans are a certain type of, employers may not have to change their plans as much. Grandfathering can become very expensive. It can become very confusing and very detailed. If you want to talk about it afterwards, happy to do so. And plans that are offered in the individual market will meet these minimum essential coverage requirements. If you do not make a lot of money, in fact, you don't have enough income where you don't even have to file a tax return, you are excluded from acquiring the insurance. There are other exceptions for religious conscience and some other miscellaneous specific situations. Employers. Here's the thing. The requirement is not imposed on the employer. The mandate, the obligation is on the employee. Employers, if they provide it, can continue to do so. The change on the employer is that before we say what's called discrimination, and no, it's not the type of discrimination based on religion, race, or the other things that we hear about. Discrimination is providing different types of coverage based upon your position or your earnings level. That has now gone away. Whatever is provided by the employer has to be standard from the top of the organization all the way down to the bottom. And the cost of, or the value of that insurance is going to be reported on the Form W-2. It is not included in income, it's not taxable income, but the government is going to know about it in part because there's going to be a charge on insurance companies if the premiums they charge are too large. There are tax credits that are built in, so employers with at least 50 full-time employees I'm sorry, jumping ahead. This is if you have more than 50 employees and you don't offer insurance and any of the employees acquire their insurance in the individual market and qualify for tax credits from the government's going to charge back that benefit to the employer. So if you don't offer it, that's fine, but if you're shifting costs down into the system is going to try and recover some of those fees, or some of those costs. For employers which provide employment, that have employees with lower wage levels, and they provide the insurance, there's actually a tax credit to encourage and assist small employers to provide this health insurance coverage to the employees. Small businesses with 100 or fewer employees will be able to get into a pooling arrangement with exchanges and cooperate together.
Can you go back a screen? There was a 10 employees or less.
Right, so employers with 10 or fewer employees, and the average annual wages of all those employees are under $25,000, which will be indexed for inflation. They'll be eligible for a full credit, whereas in the 25 and 50, it's a partial credit. Okay, I know we're running low on time. So this, what you've heard about a Cadillac plan. That is a tax not on the individuals, not on you and I, but if the insurance companies start charging premiums that exceed $10,200 annually for an individual, $27,500 for families, they'll be subject to an excise tax. Trying to create some pressure and putting that on the company to keep control on premium costs. Some things that you do need to know about. If you have earned income of more than $200,000 as an individual, $250,000 as a married, filing jointly couple, there will be an additional 0.9% of Medicare tax imposed starting in 2 years. There's also a tax on what we call unearned income, and this is a little more complex. It's 3.8%. Again, the same threshold levels. If you cross over the threshold, it'll be 3.8% of the lesser of your interest, I'm sorry, not your interest, your investment income, or when we talk about MAGI, that's your modified adjusted gross income. Basically, if you would look at the bottom page of the bottom number on page 1 of your 1040, that's your adjusted gross income. If you cross over that threshold, to the extent it exceeds the threshold amount, you take the lower of the two, 3.8% of investment income or 3.8% of the AGI in excess of the threshold amount. Something to know that's in effect right now for flexible spending accounts. It used to be you could use those dollars on anything. Now there's been some restrictions. So before, while you could recover some of that cost, like for Tylenol that you bought at the drugstore, that's over-the-counter stuff is no longer qualified for reimbursement under those accounts. There's also some other restrictions and limitations kicking in about 2 years. Also in 2013, on page 2 of your tax return, if you itemize your deductions, you can deduct medical expenses to the extent currently they exceed 7.5% of your adjusted gross income. That's going to go up to 10%. And there'll be a tax imposed on manufacturers of certain medical devices, hearing aids, eyeglasses, and other commonly used equipment will be exempt. Here is one that has gotten a lot of play starting next year. Companies, anytime they spend more than $600 with any one vendor, individual, company for goods or services, will be required to issue a 1099. When I was in Washington at the beginning of December, there's bipartisan support for modifying this. I don't think they have any idea of exactly how they want to do it or what they're going to do, but there's an agreement that this will likely change. Even though the House of Representatives yesterday voted to just eliminate everything altogether, that passed. If you haven't heard, it's not likely to get through the Senate. If it does get through the Senate, it's likely to be subject to a veto by the President. it goes back down. Both houses have a 2/3 vote of both the House and the Senate have to override the veto. We'll see where it all goes. But likely, if anything is going to be changed quickly, it's this provision. For those that are familiar with Jersey Shore, this is also called the Snooki tax. It kicked in last year for tanning salons. They must now impose a 10% tax for all indoor tanning services that are provided. With that, I know there's more material, but I also don't want to run over and deny the opportunity for questions and answers. So with that, if you do have questions, I want to ask our president, Darrel Quinn, to come up, who's a financial advisor. We also have a certified public accountant in our chapter, Rick Wallis.